Afternoon, everybody, and welcome to the Trinity Long Room Hub online. My name's Eve Patton. I'm director of the Hub, and I'm very pleased today to be partnering with the Global Brain Health Institute to welcome two of their Atlantic Fellows to come to talk to us. You'll know if you have joined us before for some of our collaborations with the Global Brain Health Institute, that the GBHI is Trinity's prestigious research institute for exploring not only brain health, but very specifically conditions such as dementia. And it does this not simply from the point of view of neurological science, but also in terms of looking at creativity and the arts as intrinsic to brain health. So we have much common ground between the GBHI and the arts and humanities. And it's a pleasure to have heard from some of their Atlantic Fellows on previous occasions. And I'm delighted that we're going to hear more about the important work that they're doing over this lunchtime session. I'm going to hand over to Professor Brian Lawlor, who's going to chair this session. And Brian, as I think many of you will know, is the Deputy Executive Director of the GBHI. And Brian will tell you a little bit more about what it does and who's going to speak to us today. Brian, you're very welcome.
Eve, thank you very much. And it's a great pleasure to be here today for this Fellow in Focus session for the Atlantic Fellows for Equity in Brain Health. So the Global Brain Health Institute really is tasked with dealing with one of the major societal challenges, which is dementia. And we're really focused on dementia prevention, taking a public health approach to dementia prevention. And as I say, it's a great pleasure to be here today to be able to introduce you to two of our wonderful Atlantic Fellows. My background is as a psychiatrist, so I'm in the psychiatrist chair at the moment, so I'm going to be listening more than talking to these fellows, listening to their stories, sharing their stories with you. And I think you're going to find some very interesting stories that they're going to tell us today. And afterwards, we're going to have an opportunity to have some question and answers where you'll be able to kind of take a deeper dive in terms of asking Francesca and Hanan some questions. So maybe could I just introduce, first of all, Francesca, maybe Francesca, you say a little bit about yourself.
Yeah, thank you, Brian, and thank you so much, Eve. I'm so happy to be here, and it really is a pleasure. I'll keep it brief. So my background is in psychology and neuroscience. I'm a researcher, and before joining the GBHI community, I was a postdoctoral research associate at in the Institute of Neuroscience at Trinity College. And my work focuses on early biomarkers and early risk factors for dementia.
Great, Francesca. And then Hanan.
Yeah, well, thank you. Thank you so much, Brian. Thank you so much, Eve. It's a pleasure to be here in the Trinity Long Room Hub. My name is Hanan Khalil. I'm from Jordan. I'm a physiotherapist in background. For this year, I'm a current fellow at the Atlantic Fellow based at the Trinity. I work at Jordan University of Science and Technology as an associate professor in a neurological rehabilitation. So as I said, my background in physiotherapy, I did bachelor degree in physiotherapy and then master and PhD in the UK in neurological rehabilitation. And my focus is on people with the neurodegenerative diseases, mainly Parkinson's disease, and also recently started to do some work related to brain health in refugees in Jordan as well.
So we have Francesca, a neuroscientist based here in Dublin, and then we have Hanan, who is focused on physiotherapy and Parkinson's disease based in Amman in Jordan. So let's kind of kick off the conversation here, and maybe I start with Francesca, maybe to tell us a little bit about your background. I mean, where you came from, where you grew up, and what your interests are.
Yeah, absolutely. Okay, so I suppose I'm based in Dublin, as I said, but that doesn't really match with my name, perhaps, Francesca Farina. So my family has Italian background, and I lived in Italy. My dad is Italian until I was about 4 or 5, and then we came back to Ireland, where we've been based now since then, and we go back quite often. So although, yes, I'm Irish, I'm based in Dublin, I think my Italian heritage has always been a huge influence for me, and maybe why I'm so interested in not just the sciences, but also the arts and the overlap between the two. I think I'm obsessed a little bit with Renaissance and that idea.
And what part of Italy, I mean, did you grow up in then for the first 3 or 4 years?
So it's a small area, about halfway between Rome and Naples. It's a town called Atina. Beautiful. It's in a valley. It's near Monte Cassino, which is an abbey that some people might have heard of from World War II. Very small, beautiful region.
And you kind of linked, you know, your Italian heritage to your interest in arts and science, but the arts in particular. I mean, tell us a little bit more about that.
Yeah, I think, you know, I would have grown up reading a lot about artists and, you know, great artists like Da Vinci, and how at the time it was easy to be interested in the sciences and the arts. And so when I was growing up, I was quite torn between the two. I ended up doing a bachelor's in psychology. And I think that was because I thought that might be a more stable career choice. I thought the arts might be a bit, oh, that might be hard to get a job, which is kind of funny now given the situation with science careers. But yeah, I think I've always had an interest in the kind of the overlaps between the two. It seems like they're very different, but actually they're very similar. And if you talk to artists and scientists, they're usually interested in the same kinds of big questions about humanity and, you know, what life is all about.
It'll be interesting when we get some of the Q&A to what some of the people here in the long room have to say to you on that.
Yeah.
So Hanan, just turning to you now in terms of, you know, I guess your background, where you grew up, a little bit different, I imagine, to Italy and Ireland.
Yeah, very different. So I was born and spent like the first 18 years of my life in Saudi Arabia. So my parents, they are from Palestinian roots. So they left Palestine in the 1960s and they moved to Saudi. My father was a vet. So he was in a job based on rotation. So every 4 years we will be in a new city, in a different place. And I think as a kid, that gave me like the flexibility just to be to meet different people and just to be in different places. So in terms of school, for example, I wasn't like I haven't spent all my year in one school, or I don't know. It was like every few years I would change school as well. But this is where I come from.
Okay, and just to ask you about, you know, the physiotherapy. I mean, where did your interest develop in that? What drew you to that?
I think the main interest is that I wanted to be doing something dealing with people. The year before I get to the university, my mother had a problem where she needed to go to physiotherapy. And I was going with her. And I just observed how physiotherapy would help people and give them a meaning to their life in terms of participation. So then I decided I'm going to go for it. So that's the main reason why I went to physiotherapy.
So there was that sort of turning point for you. I mean, seeing a physiotherapist, interacting, maybe caring and making such a difference to your mother, that was the turning point?
Absolutely. Yeah. Absolutely. And I always wanted to do something to help people. Mm-hmm. And that gave me an example. It was a very solid example. So that led me then to physiotherapy.
So just turning to Francesca, I mean, you were saying you were conflicted from a very early age between arts and science. So what, again, there was a I suppose a tipping point or a turning point, perhaps is a better term for Hanan. I mean, for you, was there any particular incident that made you go one way rather than the other?
It's a tough question. I just remember becoming really fascinated with memories and where memories come from and how strong memories can be, you know, smells, sounds, and how they bring us backwards in time. And so I became completely fascinated with that idea and how do memories form, how are they stored, and that led me to a fascination with the brain and memories in the brain. So psychology, and then neuroscience PhD really focused on that. And then in working with people, again, you know, similar to what Hanan said, people's stories made me more and more fascinated with, well, what happens when memories start to break down, which kind of led me to the area of brain health and dementia. I still remember conversations I would have had with participants who came in to do a study about one thing, but we ended up having a long chat about memory or something that happened to them in their lives. And it was kind of those human stories that happen in between the cognitive testing, if you know what I mean, when you're not focused on the task, that really piqued my interest and I think led me down this path of brain health and dementia research.
But I understand that, you know, some of your earlier work in science was really more on the basic side rather than the human side. I mean, that was the door that you went in, then you went out another door.
Yeah, absolutely. So my PhD was very much focused on the cellular basis of memory. So what kinds of areas in the brain deal with memories. And I think it took me a while to realize or to remember that brains are connected to humans in a way. So I'm really interested and fascinated to hear from Hanan as well, because a lot of your work, Hanan, focuses on movement and physiotherapy, but I suppose it's all connected, brain and body, right? So you can't really look at one in isolation of the other. And then if we want to broaden it out again, environment, society. So I think it is all connected. And maybe that's how I was able to reconcile those kinds of different streams of interest.
Well, there's a pattern. I mean, I think you followed it. It's been a journey, but there's a pattern, and you see it coming around a full circle, really, I think. That does link to Hanan's story. Before I just move to Hanan again, just in terms of, you know, one question I'm going to ask both of you, and is really, you know, influencers or what influenced, what was a strong influence on you growing up? And it doesn't have to be something scientific. I mean, what were the really strong influences on you that you think maybe formed, you know, your personality, made you who you are?
Is that one for me first?
Well, or Hanan, whoever feels ready to answer it. Do you feel ready to answer that one?
Do you have a good answer, Hanan?
Well, it's not an easy question, and I'm just thinking about it. I mean, I came from a family, as I said, my parents are Palestinians. They have a story. They have a story. They left their homes in the way that they were going to go back, and they never just went back because of the war and everything was going in the region. So one of the things I would say that my parents just put on us, that education does come first. They said, we are not going to inherit you like a land or a house or anything, or what we are going to give you is a good education. And I think that's come to me, and also to my brothers and my sister as well, that the thing that you can help is your education. And with education, I think the education, one of the things that education does for you, it just gives you that open mind that you can listen to other people's opinion, that you can tolerate other people's background. And I think living in a country that it wasn't like my hometown or my home country, it just gave me this more. And there was a lot of travel as well as I was a child. And then when I grew up as well, I did my bachelor in a university and then my master and PhD in a totally different country. It was the UK and university as well. So all this together just is the education, and then being open to opportunities, being open to other people's opinions, to other people's differences, I would say, is just one of the things that shaped my journey, I would say.
It sounds like you know, your family experience was of being a little bit displaced.
Yes. So they left. So in terms of history, there was two wars, two big wars here, one in 1948 and one in 1967. So they both left their home before the 1967. And when the war did happen, just anyone was outside were not allowed to come back in that term, just basically that term. So yeah, it could be described as displaced.
Well, I'm kind of moving towards some of the work that you're going to talk about later on. It's just it's an interesting thread perhaps, but it sounds to me like your parents, your family were very, very strong influences in terms of who you are and what you are, in terms they were a constant and for you.
I would say yes.
Yeah.
Definitely.
And the education. So back to Francesca, I mean, any thoughts on your strong influencers?
Yeah, I'd have
could be anything or anybody, by the way.
I'd have to totally agree with Hanan. I think the openness is something that I would have also gotten from my parents, and the idea that, you know, not to think of yourself as better than other people if other people are different to you. And I think that was something that was always very instilled in us, in me and my brother and my sister, that, you know, I think it's possibly to do with first generation, maybe university or something like that, that, you know, education is so important. And even when you have the education, that doesn't necessarily make you better than somebody else, or not to have airs kind of or notions. And that to stay grounded, I suppose, and that was something that they would have taught me and has really, really stayed with me. And I think it links back to what Hanan said about an openness and respect for other people and other people's ideas and where they're coming from, and to try to always meet people halfway or meet people some of the way where they are. To give other examples, maybe the only other thing I can think of is like role models from TV, you know, powerful women examples. You've heard me talk about this before, Brian. I'm not going to go off on a rant again about powerful women, but I think
you have to remind me. I think I've forgotten. Remind me.
Well, I think I've mentioned people historically in Ireland, people like Constance Markievicz, you know, people and the women's movement here, but also examples from TV, if I'm going to mention Star Trek, Captain Janeway, you know, people like this who were powerful examples of women in leadership positions. Also, I guess, would have been an influence on me as I was growing up, looking at them and thinking, oh, I'd like to do that maybe.
I thought you were also a fan of John Hume.
I am, yeah, and I did my PhD and my undergrad in Maynooth University, and I was based in the John Hume building for 7 years. So yeah, absolutely, John Hume would have been a huge influence, and I think a perfect example of what I was just talking about, you know, meeting people halfway. Absolutely, yeah.
Just before I go to Hanan, just about John Hume, I mean, what characteristics do you really admire in him, and probably in other people like Countess Markievicz and as well, but John Hume in particular, what characteristics do you really admire?
Respect, a fairness, an openness. I mean, to do what he did for as long as he did, and to never become jaded or to let that turn into anger, to just stay so true and focused to, you know, the well-being of people in Northern Ireland. That was his focus, and it was never about the divide, and it was never about winning. It was about creating a new society that could benefit everybody.
So, I mean, a lot of these values, I mean, obviously are GBHI values as well, in terms of we talked about openness, respect, fairness. So it's just interesting to hear you to speak to that. And so, Hanan, in terms of characteristics that you would admire in people, what would be your top one or two?
Yeah, I think the number one is just openness. Just being open to others, being open to differences in people. I would say we are different, but I look at these differences as enrichment rather than a threat. So I always like also dealing with people who would have the same mindset. And also the courage, just having the courage to go out of the comfort zone, to things that are different, sometimes that they sound or looks weird or even crazy, but in a good way, I mean. So yeah, so openness and courage.
Yeah, I'm struck by, two people who are, very different from very different cultures, very different backgrounds, but in fact, as the story emerges here today in this conversation, you're very similar in many respects, aren't you, in terms of your perspectives and your values. So Hanan, just talking to you a little bit, kind of delving a little bit more into your research focus, because I think people on the webinar will be very interested in hearing a little bit more from you and from Francesca about the work that you're doing and how you've come to this work, to the point you're at the moment, and GBHI. Maybe tell us a little bit about maybe journey into GBHI, but also your passion around the kind of research and the work that you want to do.
Yes, so to talk about it in general, and then the work that I'm doing in the GBHI.
Whichever way, yeah, both.
Yes. I think from the first year when I was doing my physiotherapy, I decided that I'm going to go into a path that it's in neuroscience or in neurology, because I think that goes back to one of the teachers that taught us neuroscience in undergrad. So I loved it. Just loved it, how the brain works, how the brain get to do different things, and when there is an injury or disease, what happens, and then how can we help people who have a brain injury or disease. So when I moved into my postgrad, I was very clear. I was very clear right at the beginning that I'm going to neuro rehab. I did the master and the PhD at Cardiff University. And it was a neurological rehabilitation with work that was focused on Huntington disease. And it was, we were one of the centers who were really started to do work related to physiotherapy in Huntington. So in Huntington, in terms of physiotherapy, wasn't touched. So it's kind that
Huntington's, people might know what Huntington's disease is. Perhaps you might tell us.
Yeah, so Huntington's disease is a neurodegenerative disease, but it's comes from genetics. So it's a genetic disorder. You need to inherit like a dominant chromosome from one of your parents to get it. And then it's a neurodegeneration in the basal ganglia in the brain, one of the areas in the brain that controls movement, but also relates to the frontal lobe. So it has something to do with cognition and behavior. So it's one of the fascinating disorders to deal with as a physiotherapist, because you see everything in one patient. You see movement, so they have this movement, they have the chorea, the big involuntary movement. They have also the cognition problems, the cognitive problems, and they have the behavioral problems. So it's a triad of problems. Because as physiotherapists, we always used to deal with the physical side and deal with people who have like physical problems, but not necessarily cognitive and behavioral problems. So I came to it from a movement part. So we were focusing on analyzing the movement, doing some movement analysis, exercise program that would enhance walking, movement, balance, etc. But it was fascinating because to reach this, you really need as a person to deal also with the cognitive and the behavioral part, just to be able to communicate and deal with the person. So that was what I did in my PhD. And then when I moved back to Jordan, I shifted the attention. So I was in the same area in a neurodegeneration, but started to focus more on Parkinson's. The main reason that I didn't continue in Huntington, that there wasn't a genetic test on Huntington disease. So in terms of research, you can't only rely on clinical examination. You have to do the genetic testing, and the genetic testing wasn't available. So I started to work with Parkinson's, which I did some of it during my PhD, but it wasn't the main focus. And it's again on the area of exercise and physical activity, how exercise and physical activity can help these people to overcome some of the problems that they do have, particularly in terms of gait and balance. But then the more and more that I did with these people, I realized that also their cognitive issues does interfere with their daily life. And we've done a few years ago a study where we asked people, it was a questionnaire, where we asked people then, if you have, can you say in your words, the top 5 areas that it would bother you. And then if you have, for example, 10 pounds, where would you spend this money on, in which one of these areas? And probably I was biased as a physical therapist, saying, oh, they will say walking. The walking is a big problem in Parkinson's. But then area number 1 that it came, it was emotions, cognition, that kind of thing. So I started then to shift the focus. What can I do as a physiotherapist to help them in this area? So we started to shift our work in terms of exercise and physical activity on managing the non-motor symptoms, and in particular, the cognitive and the behavioral and the depression that they have. Now, last year, I joined the GBHI, and I would say that that was very timely because I was just started to do some work with the refugees in Jordan, and it was a totally new area for me. I'm bringing my physiotherapy expertise and my research expertise into this area, but as a population, it's a new population to deal with. And I would say it was very timely because I think that the fellowship just gives that thread and depth in terms of the knowledge and the skills of how to deal with such a population. It's focusing on dementia, but there is a big aspect about psychiatry as well. So this is what I'm doing now, and this is what I will do through the fellowship, and hopefully by the pilot project that we will do with the fellowship as well.
This all makes perfect sense to me in terms of your journey and your movement into brain health and the mental, psychological, emotional aspects of the patients that you treat, and how important it is. And I think it's about I suppose this is really the story of GBHI in terms of how we're trying to bring people from different professions together. So as a physiotherapist working on motor aspects and now moving into brain health aspects. I guess, Francesca, your story is a little bit, it's different, but it's similar in some respects in terms of your transition and pivoting, isn't it?
Yeah. So I mentioned already that my PhD was on real cellular basis of memory. And I think from there, I started to shift to more cognitive levels. So after my PhD, I moved to UCD, University College Dublin, where I was looking at false memories. So the idea, how can we remember something that never actually happened? And from there, that led me to, well, what happens when memory breaks down, as I mentioned. And I think similarly, I was expecting people to be more worried about the cognitive aspects than the emotional aspects. And then I realized in talking to people that those emotional aspects, things like depression, like you mentioned, Hanan, are so front and center for people. And that's what led me to the work that I'm doing now in GBHI, which focuses on psychological and psychosocial risk factors. So things like anxiety, depression, social isolation, loneliness. And one of the things I'm particularly interested in is fear, and fears and anxieties around dementia and how they can influence people. So we did a recent study that showed that people who were more older people, so people over the age of 55 who were more fearful of dementia, rated their memory performance significantly worse than people who had less fear. And this was irrespective of their objective performance on tests. And it was also irrespective of people's general anxiety levels. So that to me was really important in showing that it's people's beliefs and fears that can actually start to have a negative impact. So as part of GBHI, I would like to look at these kinds of factors and see specifically early on in midlife how they might influence people's trajectory. So how fear and avoidance of a topic could lead people to become, for example, more socially isolated, which we know is a potential risk factor for dementia later in life. And I think in terms of the timeliness with COVID, there's so much fear and anxiety at the moment, and there is so much isolation, particularly for older age groups. So for me, it felt like joining GBHI almost, happened just at the right time to be looking at this work.
Right. It strikes me from what you're both saying in terms of, sometimes maybe we focus on what we think is the right thing to focus on, but not necessarily what the person who has the problem wants us to focus on or needs us to focus on. And I think understanding the brain health aspects of all of these conditions is really, really important. And actually collaborating or co-producing with the person, understanding what they want, what their needs are, is so important. Not what we think is important, but what they think is important. And also, I think it speaks to the fact that there's actually a lot that we can do, you know, in terms of the fear. I mean, I know your work, Francesca. I mean, there's a lot that you can do with the fear and anxiety. You can actually change behavior by going in that door as opposed to taking another approach. Likewise, for people with Parkinson's disease, I think there's a lot that you can do in terms of the emotion, the depression, the anxiety that can actually improve their level of function. So here's another area, I guess, that the two of you are talking to one another. So just before we've got, there's a couple of the questions I just want to ask you. One question was really with regard to, I mean, say, Francesca, I know you're talking about the work that you're doing in fear of memory loss, but obviously you're also doing work in terms of arts and arts practice. But I'm just curious about, my question to you is, what do you really want to change, you know, in your professional life? And do you think you're going to be able to do this through GBHI?
Yeah.
You can be thinking about that, Hanan, now. I'll get on to you. Okay.
Big question, but I think ultimately it comes down to perceptions and the narrative, the societal narrative. I think we still have a culture of shame around a lot of things in Ireland, and a sense of push it under the rug, don't talk about it. So if I could sum up what I want to change in one sentence, it would be that. So if somebody's fearful, or if somebody is living with dementia, that they wouldn't have to be afraid to talk about it, and they would feel like they could talk about it to a friend or a colleague without fear of stigma or being treated differently. And yes, I really hope I can achieve that through GBHI.
And Hanan, what would you like to achieve?
Yeah, it's something similar. I think one of the things when it comes to neurodegenerative diseases in the whole Middle East, I'm a part of a task force for the Movement Disorder Society. And there is a big thing about awareness. There is a big thing about the services that are available to these people, and then the options for them that they can seek. So one of the things that I really hope that I can do through my journey is really raising the awareness, making some resources that are accessible and acceptable to them, available to them. And in that, I think when it comes to our countries, the hierarchy, the systems, the rigid system are very difficult to deal with. So what I'm hoping is that we can use the technology to bring things to people to their door without the need that they can really go through systems. So I'm trying to exploit that thing of having the technology helping the people as well, or making some resources, some options for them that they can use, and they can know more about what they are going through by doing this.
So raising awareness, decreasing stigma, enabling. I think this is what I hear the two of you saying in terms of what you want, how you want to change the narrative. For the last few minutes, I just wanted to maybe ask the two of you, I mean, how, given that you seem to have a lot in common, not so much different, but a lot in common. I mean, how do you think you can help yourselves, help one another, I guess through GBHI, outside of GBHI, you know, just moving things forward? I mean, given this conversation that we've had, I mean, any thoughts on that in terms of how you can help one another as, you know, as you transition through the fellowship year and beyond, in terms of the work that you're doing? Any thoughts? Maybe Francesca, do you want to, any ideas on that?
Yeah, I think it's all about the connections that we're making, Hanan. You know, in any other fellowship or any other job, we would never have met. And I know that, you know, it's a shame that COVID is preventing us from meeting in real life, but the kind of the relationships that we're able to build through GBHI, I think, and being put in a room together where we are actively looking for that common ground and having those different voices in the room. I think knowing about your work, Hanan, you know, we we present to each other often in GBHI, and I can say that your presentations and the other fellows have given me ideas I never would have come up with, because you're coming at a similar question from a different angle. So to me, that's it. It's having the opportunity to listen to people who you wouldn't normally get to, and finding new ideas and new synergies from that.
Yeah, absolutely. I totally agree with Francesca. I think one of the things that GBHI did offer to us and is continuing to offer is that very unique network and the people, the amount of variety. I mean, this is the first time for me. I've been in different networks and different committees, etc. But this is the first time, for example, that I'll be in a network where I have this amount of talent and variety around me, like having artists and just listening to them and to their perspectives about brain health, journalists, people who speaks about economics, etc. It's just widen too much your horizon. And I think this is, in that term, I think it's a very, very rich experience for the amount of ideas that can be generated and for the amount of the work that can be done.
You know, at the top of this webinar, Eve mentioned about, you know, the links between GBHI and the Long Room Hub. I think, you know, it's been phenomenal, some of the things that we've been able to get to do together, science and humanities connecting. I just wonder, what would you say to people listening in now? They're going to have an opportunity to ask you some very difficult questions in a moment, but in terms of the links, not just, you know, within GBHI and across GBHI, but what about outward into the Long Room Hub and into the humanities networks? Any thoughts on that in terms of how that might be impactful for the work that you want to do, the changes that you want to make? Maybe Hanan, any thoughts on that?
Yeah, I think there is a big room for that. And I mean, for me, as a very traditional researcher and academic, I would do the work, but then having someone, for example, from a humanity or art, transferring this, it's about conveying the message, and it's about the level of awareness that I was talking about. Then this is where the talent from other disciplines in the humanity and the art, it's help people who are very good in writing, people who are very good in telling stories, people who are very good, for example, in telling the message through drawing or through doing some sort of art. It's that thing that I think it's very needed and it's very interesting to me.
Francesca, any final comments there in terms of links out to into the humanities here, people that we're talking to right now?
Totally agree with Hanan. So obviously I've mentioned my interest in the arts and creativity. So, you know, absolutely, I think there are so many opportunities for productive overlap. And I think it just comes back to, you know, more heads in answering these questions, and that I genuinely think we can tackle these big societal challenges more effectively when we come together this way and when we have different voices in the room. So yeah, I would say any opportunity we can come up with like this to, you know, to have these conversations and spark ideas off each other would be brilliant.
Okay, well that's, I mean, we're now 20 to 2. I think I've been instructed by the other Francesca to stop at 1:40, so we could open up for questions. And unless I see Eve has joined us again. Eve, was there any comments that you wanted to make before we open it up?
Thank you, Brian, and wonderful to hear both Hanan and Francesca talk with such lucidity about the work they're doing. And I've lots of questions. But maybe I could kick off. I know we've got some in the chat, but to all three of you really, which is having heard, you know, your two fellows here talk about Palestine, talk about Italy, and you are a global institution, Brian, and I know that you collaborate with the University of California at San Francisco. How much does the fact that you've got so many different national cultures and perhaps different faith backgrounds too, how much does that affect the way that research happens in the Institute? Does it have an impact? Does everything get leveled? Or are these differential factors in people's backgrounds still playing on the way in which you carry out research?
Well, I guess we're primarily GBHI, the Atlantic Fellows Working in Brain Health, is primarily a training program. So it's a leadership, a training program for people who are really going to kind of go out and make a change in terms of brain health and dementia prevention. So yes, there's a research component, and people can apply for funds to do a research project, but it's really about training and education rather than research per se. I think that there are challenges for us in terms of running a program like this between Dublin and San Francisco. I mean, bringing people from multiple, such a diverse group of people to places like Dublin or San Francisco, it's challenging in a sense that we are challenged ourselves in terms of delivering a program to people who are coming from such diverse backgrounds and such diverse cultures. And the whole concept of diversity, equity, inclusion, and belonging, is something that we've had to take a very serious, long look at. As people here at Trinity are looking at in terms of dealing with diversity, we've also had to do that. And when you look at Trinity and you look at Ireland, we're not that diverse. We are diverse in many ways, but we're not that diverse. And obviously there are diversities within the US, but again, it doesn't capture all the diversities of the fellows that we have coming. So that is a challenge in terms of people being able to see themselves, identify themselves in what we do and how we behave and how we try to express our values. So, that's been a journey for us over the last 5 years, and we're focusing, we are focusing on trying to improve how we do that. I'm not sure whether you see that that's a challenge for you at the Long Room Hub as well, but it's certainly a challenge, and maybe it's an area that maybe we could talk to one another about and share some learnings and maybe talk about the mistakes that we've made and maybe some of the things that we've done to try and improve it. So so that's on the challenge side, but really on the positive side, I think when you bring people, as Hanan and Francesca were saying, into the room from different backgrounds, different cultures, there's such a richness there. You learn so much, and you learn about how maybe things can be done differently, and how things can actually be done better by listening to all these other voices. So some of the ideas that I have now in terms of how I might approach, a patient or a person, has been changed even in Ireland in terms of listening to how it's done elsewhere, and how the approach might differ. I think we've learned an awful lot from the arts and humanities in terms of narrative storytelling and how important that is. I think, one of the things what Francesca and Hanan spoke to today, and which is so true in terms of sometimes you thinking you have the answers to like I'm talking about a patient as a doctor, it's problems, but in fact, you don't always have the answer. You have to, sometimes you have to listen to the person to understand, what is the right approach. And I think that sort of humility and I suppose collaboration with the person is really important. And I think, you learn more about that from listening to these diverse voices. I think, so there are challenges, but I think there's such a richness to what you can experience and what we can all learn together, that, as I say, I never thought, at this stage of my career, my life, that I would be still, that you would be learning so much. And I think that the GBHI does give you that just fantastic opportunity to learn. And again, I think Francesca and Hanan talked about this openness, this curiosity. I think you need that. I'm not sure whether I've really answered all of your question, but I think I've given you a sense that it's powerful. I think the experience is powerful. I think you probably see that at the Long Room Hub as well. Everybody that walks in is different. They tell you something different. They teach you something different. This is not, I mean, I suppose it is, we learn from one another. It's not about it's not teaching, it's about learning. And I think we're learning an awful lot.
Well, that's good to hear. And of course, we could talk all day, Brian, about connections between our two institutes, but I see questions in the chat. So I'll hand back to you, Brian. I know there are people anxious to put their questions to Hanan and Francesca.
I'm just looking to see, I don't see, the questions aren't coming up to me. Let me see, are they coming up for you? Oh, so Q&A, sorry, excuse me, I'm looking at the wrong place. I was looking at the chat, apologies. Okay, so, so here's a question, and I think this is from Mary Buzzell. Could one of the positives from COVID be that hospitals, medical professionals would change the way treatments and hospitals and nursing homes are run with a view to making it a better experience for the patient? Now, maybe that's kind of speaking to perhaps some of the comments that Hanan made. I mean, I can certainly try to answer. I mean, I think COVID is changing, and it has changed, and is going to change, is changing the way you know, we're going to deliver treatment. I think the whole idea of nursing homes, for example, I mean, the idea that this is that maybe we need to, you know, we obviously need to focus more on trying to keep people out of nursing homes, and look more to finding ways to support caregivers and people with dementia at home, avoiding nursing homes, because you know, obviously the terrible difficulties that the restrictions have created for people with dementia and for family members. So I think that, yes, I think it is going to accelerate other types of developments in this area. I think it's certainly in Ireland is going to change the governance of nursing homes, but also I think it's going to change the focus away from long-term care and care homes and trying to get care in the home and to make that more effective. I'm not sure whether Francesca and Hanan want to comment on that.
Yeah, I'll just jump in really quickly to add. I think that a lot of people have been talking about things going back to normal and how much that scares other people, because they're saying, well, normal wasn't really fit for purpose for a lot of people. And I think nursing homes are a great example of that. And if we think about the initial reaction to COVID and the idea that, okay, no one can go into nursing homes and that's that. And I think if this was any other portion of society, that type of response would not have been acceptable. You know, we wouldn't do that with children. We wouldn't say they have to be isolated now for months on end. And I think that's what COVID is showing up, that a lot of these systems are just not fit for purpose and need to be changed. So I think absolutely a positive from this is that we have the opportunity now to look at these things and to redesign or try to reimagine how things are done. I don't know if you want to come in, Hanan. I know you unmuted a second ago.
Yeah, I mean, probably it's a different experience for me. In Georgia, for example, having very few people would use the nursing homes because the pattern is still that extended families, and that the elders should be cared at homes by their children and the grandchildren. So the use of nursing homes is not that awful, although I would say in the past few years, the pattern has started to be shifting a little bit. And now because of COVID, everyone is just worried, and then everyone is keeping elders at home and avoiding the nursing homes. So in that aspect, I would say COVID, yes, did some impact, but for us, it's not very big because to start with, for example, for the whole country, we don't have that many nursing homes. So we don't have that experience of dealing with nursing homes, I would say.
Okay, so from Richard Doan, are there reasonable, reliable records now available from most countries so that patterns of the prevalence of neurological illnesses in certain regions, countries, nationalities, environments can be detected?
I can kick on this. So speaking, for example, of Parkinson's disease, most of the data that we have is coming from Western countries. There is now more efforts and more task force at the bigger levels going on that we really need to understand this globally, because understanding this globally does help us to understand the disease itself. So I would say it's growing up. Most of the data still are coming from Western countries and developing countries, but it's getting better in terms of understanding the picture in other countries.
Yeah, and I think to just add to that, I think GBHI is to the forefront in this regard. I mean, there's an initiative called BrainLat, which is looking at you know, dementia in South America and GBHI is very involved in this, and also efforts in Africa. So I think there probably are different patterns and issues, particularly around genetics as well. So and this is beginning to start now, and it's going to become a big focus of interest. But most of the data up until now for most of the neurological conditions has been from high countries and may not be representative of what's going on in low and middle income countries. And so the pattern of even prevention, modifiable risk factors, looks different in low and middle income countries. So we need more data on that. And I think that our fellows, we hope, will be very much involved in the years to come in that regard. Now we have a question from Stephanie Kennedy about, is there any research exploring the value of knitting and craft groups for brain health? Her experience in running these groups has shown her that there's fantastic benefits for cognitive health, but also providing social connection and emotional support. Yeah, I think I would agree with that, certainly. Francesca, Hanan, any comments? And this is all about sort of, I suppose, building cognitive reserve and leveraging social activities. Mm-hmm.
Yeah, absolutely. I think probably the artists in our cohort would be better placed to answer this question. But yeah, lots of research, exactly as has been said. It's not just the cognitive aspects, but it's the social aspect as well. A lot of the time, that's really good for people and really good for brain health. It's that connection. It's that being engaged with your local community. So yeah, absolutely. There's a lot of growing evidence for that, and I think the UK have done a lot of work into the benefits of the arts. And I think with these groups as well, there tends to be better retention. So oftentimes when you have a kind of an intervention or something that's designed to help people with their brain health, it's either, it's not very engaging or it's a bit boring and people tend to drop out. But with the arts and with creativity, what you find is people stay for longer and will stay till the end of the program.
Just a question here from Karen Meenan. Has GBHI changed your view about starting a conversation about dementia? And if so, what's the difference? Maybe Hanan, could you take that one? Has it changed?
Yeah, I think it did. I think it's very important just to bring too many disciplines, too many stakeholders. And if I was thinking about stakeholders before, I wouldn't think how much important different disciplines, such as people from humanity and science, are important to be at the discussion table, really. So in that aspect, it did, yes.
Francesca, there's a question here for you about John Hume from Jenny Pa, which is, did John Hume's dementia influence your thinking and your work?
Yeah, it's a really good question. I remember seeing a documentary on John Hume, and they talked about how he would go for walks and still like to go for walks even towards the latter stages of his dementia, and how the whole area would look out for him. And they knew, like, there's John and he's going for his walk, and, everyone would make sure that, he was okay, or did he need help getting home? And I think it reinforced this idea of community and society, and how brain health should be a societal problem. It's not just about health, it's not just for the Department of Health, it's all of us as a society and as a culture coming together. So I think that maybe is how I could say that his experience would have influenced my work.
So again, this might be a question for you, Francesca, or Hanan. Is either of your research, have you seen evidence of neuroplasticity occurring leading to recovery? I mean, maybe in the Parkinson's disease, have you seen?
Yeah, I mean, in terms of exercise, for example, the work that I'm doing, there is good evidence that exercise, first of all, does work as a neuroprotective. Mm-hmm. This is coming very clearly from the animal studies, and there is also some evidence from registry data and also from epidemiological studies where they have these cohorts that they follow up, that being an exerciser midlife does reduce your risk of having Parkinson's disease later in life. And even after having Parkinson's disease, just staying active and being active 5 days in the week, it does slow the progression of the disease and give you a better quality of life. So in that aspect, yes.
So for Carol Houlihan, is gender difference a strong feature of your work? And Francesca? Hanan?
Yeah, I would say it's something I definitely do think about a lot. We know that women are have a higher risk of dementia. We also know that women are more likely to be caregivers, primary caregivers, and we also know that most caregivers don't get paid for caregiving. So I think there's a lot to think about there and unpack in terms of that additional burden, maybe particularly of older generations who would have stopped employment earlier. So yeah, definitely something I'm thinking about. I think there's a lot more research now, but a lot more work has to be done in figuring out why that higher risk is there for women and what are the factors contributing to that.
Jenny Pa asked about giving some examples or links in the chat. I think we could do this afterwards about arts organizations and individual arts practitioners. I think we could probably do that. And then Teresa McDonald Fristrom just made a comment here. Her husband is coming home from Tala University Hospital today. She's been a carer for 8 years for her husband in Sweden and in Ireland, and she's very happy with the possibility of the help that a nursing home offers, and that the help at home only added to her workload. And the idea of having to continue with home care, she said, now terrifies her. So, but I think the happy situation that her husband is going to the nursing home. And I guess that's, I mean, these are different perspectives from different people, and completely understandable. And I think sometimes, you know, that obviously long-term care and nursing home care is necessary and really, really important. I think some of the conversation we were having earlier was really about, you know, just you know, reimagining or changing, you know, the focus. But I think no matter what, I think nursing home care is going to be necessary and important for many people.
And maybe just to say really quickly there, Teresa, I think is, you know, that's why it's so important for researchers to work with people like you who have lived experience, because it's no good me designing research studies without ever having spoken to you. And, you know, so that's one thing that I know we're also working on in GBHI is getting more representation from people with lived experience who are either carers or people living with dementia. So it's so important to have those views.
Okay, well, I think we got through the questions in the chat quite efficiently. So well done, Francesca and Hanan. I mean, I think it's probably we could probably just wind up now. Eve, is that what you got?
And thank you very much, Brian, for sharing, and thanks to everyone who sent in questions and put in comments. There's tremendous interest in this very varied topic, and I just want to reassure everyone who has tuned in that we're having several conversations between the Long Room Hub and the GBHI about subjects that we can tackle, which are common interests to both of us. And we have talked, I know, Brian, about having a dedicated symposium looking at the question of memory itself and how the arts and humanities approach this subject in different ways, and how that informs what your team is doing. And I know that we're also engaged in a bigger conversation about creativity and brain health. So these things are all very much in motion, and the Trinity Long Room Hub will make sure that we keep our audience today informed about events or conversations that we're going to have in the near future on these. But for today, I want to thank everyone who's joined us this lunchtime for a really interesting conversation. Thanks to the team at the Hub, as always, to Brian for joining us again and for chairing the session. But Francesca and Hanan, it was just inspiring to listen to you both. My thanks to both of you for giving up time today. I hope you'll come back and see us in the Long Room Hub very soon. And thank you everyone for listening. Goodbye.
Thanks again.
Thank you.
Bye.
Bye-bye.